طيب day surgery. بسم الله الرحمن الرحيم. What is day surgery؟ كلكم سمعتوا بأشياء day surgery سواء في private ولا governmental hospital. Terms refer to the whole process of assessment, planning, performing minor or intermediate surgeries or diagnostic procedure. What does that mean؟ معناته إنه كل البروسيس كاملة إحنا نسميها day surgery. Is not the only الكم ساعة اللي يدخل فيها المريض عشان يسوي العملية، لا. كويس. What is the short stay surgery؟ هي short stay surgery معناته أكثر من الدي surgery، معناته as above but inpatient stay extend for few days، يعني ينام البيشنت في المستشفى. طيب there are many ways of day surgery non-planned and pre-planned. طبعا the non-planned one إنه يكون the decision making يكون during the surgery itself، إنه كنت جايب مريض you got a patient for example a lab chole. Let's say a lab chole and you planned it as إنه the patient stay for 1 or 2 days, but during the surgery you decide that the patient has straightforward surgery, he doesn't need or she doesn't need to stay, then you decide إنه تطلع البيشنت at the same day. So هذه unplanned. The pre-planned one which is the best and هذه تكون في أقسام قائمة في المستشفيات على هذا الشيء. Always there is a special department called day surgery department في most of the hospital. يكون arranged how يكون pre-op في decision من decision مع البيشنت in the clinic or in the OBD by the surgeon إنه it will be a day surgery. يكون the patient already seen by the anesthesia before in the clinic and all of the investigation done and يكون planned and ready for a day surgery. What is the process of day surgery? طبعا patient selection is very very important. Patient counseling with the patient and describing what will happen and what the patient should do. Preoperative assessment and relevant investigation is very important. Future appointment and preoperative preparation instructions, admission procedure, post-operative assessment in case of emergency, what we will do, and follow-up. نبدأها واحدة واحدة. Patient selection. So the procedure itself. So minor or which procedure can go for day surgery? Always minor or short intermediate surgeries could be done as a day surgery case. طبعا day surgery doesn't mean only local anesthesia. في ناس عندهم المفهوم هذا إنه only local anesthesia or regional anesthesia can be done as day surgery. No, even general anesthesia can be done as a day case. Patient medical condition, this is the most important thing, not the procedure itself. Procedure is important, but it's even more important. ولا type of anesthesia, the patient condition himself. Okay, there are high-risk patients and low-risk patients. I can do simple procedure like lipoma resection in a high-risk patient, كويس, which is more difficult, or I have to be more concerned than doing bigger procedure like lab chole in a healthy patient. واضح? So patient social life also is very important. So for example, if you have patient coming from far away, doesn't have any accommodation here, doesn't have any family or somebody to stay with, it will be difficult for him to discharge at the same day, right? So always we have to consider that in our selection criteria. Patient residence داخل تقريبا في social life as well. We have to make sure that the patient has accommodation in the same city to stay a couple of days before leaving to his far area. Patient counseling, this is also very important لأنه فيه كثير من المرضى ما يفهمون إيش المفروض يصير وإيش المفروض ما يصير. So he or she should know the importance to remember and follow the instruction. الinstruction اللي هي in case if you have this, if you have that, to have to come to the emergency. In case if you have this and that, you have not to come, you have to call. And when you have to come, when you have to not be worried. Also, they have to understand when they have to come for the follow-up as well. Okay. Preoperative assessment and relevant investigation, as I mentioned, throughout the history taking and physical examination, we have to know which investigation that we have to ask for. طبعا يعتمد على الage على أشياء كثيرة. So, and also assessment by anesthesia outpatient as an outpatient is very important. Future appointment and preoperative preparation instructions. This is also very important. The patient is to be given a verbal and written instruction. هذه مهمة جدا. أحيانا after the surgery نقول المريض instructions and then المريض ما يتذكر ولا شيء because he just had the sedation, for example, and he's tired. So لذلك it's very very important to give the instruction before the surgery عشان يتذكر المريض ويكون صاحي. وأيضا it should be written as well. في أشياء كثيرة مهمة كويس should be written. لأنه المريض زي ما قلت لكم في أحيان كثيرة إحنا نكلم المريض بعد العملية، أوه الحمد لله على السلامة، خلصت أمورك طيبة، بالله عليك لازم تسوي كذا، لازم تسوي كذا، لازم تسوي كذا، تجيك بعد كم يوم ما سوى ولا شيء، والله ما قلت لي يا دكتور، ما انتبهت. أوكي. Admission طبعا before any admission you have to check all of that. Admission نتكلم على day surgery admission، لازم يكون في paperwork تكون كلها خاصة. The patient had all of the investigation, seen by anesthesia, seen by signed, consent signed, counseled, everything. The procedure itself could be minor or intermediate procedure, طبعا not major. Okay. Could be also diagnostic or therapeutic procedure. Okay. Procedure could be urgent, like abscess drainage and day surgery as well. Could be elective. Type of anesthesia as well, as I mentioned, could be local, regional, or general. Okay. We have to make sure that we give a patient good analgesia after the surgery. But there is a very important point, not all of the cases that can go directly. You have to, all of the cases after the surgery or the procedure needs to be assessed and cleared to go home, even though the plan was to send them home, but you have to assess and clear them again because sometimes some complication happen after the surgery. So reassessment after the surgery is very important. And patient needs to know the complication that can happen after the surgery and to give all of the instruction to him. So in case of emergencies, as you know, some of the complications can happen like bleeding, fever, bleeding. طبعا any bleeding can be major or minor bleeding. We treat it accordingly. Fever or discharge from the wound. طبعا the patient needs to know these لأن the complication can happen later at home. So he needs to know that if there is a bleeding, if there is hematoma, he needs to come back to the hospital. If there is fever or discharge, means there is an infection, right? Follow-up is very important. Okay. Usually there is no difference between the follow-up after day or non-day surgery. And if you need to see the patient in 2 weeks, needs to see the patient in 2 weeks. لأنه يعتمد على the procedure itself and the complications. So not only for surgeries, the day surgery could be done also for diagnostic modality like endoscopy, like MRI, like interventional radiology, angioplasty, all of that. Best to start patient selection during the first clinic visit. يعني لما يجي المريض للسيرجن من البداية تقرر له عملية في البداية أفضل تكون مقرر إذا day surgery or not. Hospital stay could be extended according to the procedure event. طبعا if there is anything happening, the procedure took longer time, anesthesia took longer time, minor complication happened during the surgery, so it's better to extend the stay. طبعا appropriate procedure for the correct patient is the best thing or the stone of the day surgery. Any question?